Welcome back to NurseEdScholar. So, at this point in the respiratory series, you understand respiratory failure, COPD versus pneumonia, oxygen therapy, ventilation versus oxygenation, early and late stage deterioration. But the NCLEX, they don't test these concepts in isolation, right? It tests your ability to apply them under pressure. I know you've heard in school all the time talking about, hey, it's not memorization, it's application. And so in this lesson, we're going to kind of walk through full respiratory case scenarios and focus on, one critical skill, and that's choosing the next best step. You know, it takes practice to really learn what the next best step is. And with that, you have to memorize, you have to retain information, but in real life, it doesn't present like that. It presents like, how am I going to apply this knowledge? How am I going to pick the right interventions? And how do I evaluate what I have done? So let's begin. Now, first, we're going to, go back and talk about the respiratory framework. And we've mentioned it in other parts of this series. And, you need to remember that every respiratory question can be broken down, with three decisions. And that would be number one, is this an oxygenation problem? Now, remember, pneumonia is an oxygenation problem. Number two, is this a ventilation problem, like COPD? And number three, is the patient stable or deteriorating? So think back to that deterioration sequence. How does the patient progress? How do they progress from normal? And then what signs do they show to let you know that they are deteriorating? All right, so let's, start with our first case study. We're going to talk about pneumonia and oxygenation failure, right? So question is, starts off, a nurse is caring for a patient diagnosed with pneumonia, right? And in their assessment, or in your assessment, you notice the respiratory rate is 32. The oxygen saturation is 84. The patient's restless, they're anxious, they're using accessory muscles. So the question is, what is the priority nursing action? Is it encouraging deep breathing? Is it applying a nasal cannula at 2 liters per minute? Is it applying a non-rebreather mask? Or is it administering a sedative medication? So I'm going to give you a second or two to think about it. Okay, so the answer is C. You want to apply a non-rebreather mask, and you're like, okay, well, why, right? But understand the patient is experiencing severe hypoxia. Remember, their oxygen saturation was 84%. So, and then they were tachypnic, they were restless, so they are exhibiting oxygenation failure. And they're going to need rapid oxygen delivery. I mean, think about it. You know, one of the responses was encourage deep breathing. That's not going to work with the oxygenation. It's too slow. The patient is severe hypoxic. B, applying 2 liters of oxygen per nasal cannula. It's not enough oxygen. This person is 84%. Okay, so they need more. They need more oxygen. And D, giving them a sedative, you're not gonna want to do that, because what does a sedative do? It suppresses the respiration. So we definitely don't want that. Okay. One thing you want to realize that on the NCLEX, if your patient has a low oxygen saturation and they're in distress, remember this patient was restless and anxious, that is an oxygenation emergency. All right, let's move on to the next one. Now you have a uh, COPD. We're going to talk about ventilatory failure. So you're the nurse, you're assessing the patient with COPD. You find that their respirations are 10, their oxygen saturation is 91%, they're drowsy and difficult to arouse. What's the priority action here? Are you going to increase the oxygen to a non-rebreather? Are you going to encourage deep breathing? Are you going to assess for CO2 retention? Or are you going to administer a bronchodilator? I'll give you a second. And so the answer is C. You're going to assess for CO2 retention. And you're like, why? Well, the respiratory rate of 10 lets you know that there is hypoventilation. The patient has a decreased level of consciousness. They're drowsy. They're difficult to arouse. And so with those two things, you're going to be concerned about CO2 retention. Um, Now remember, in the hypoxic drive video, when a person with COPD is given too much oxygen, like you're giving them oxygen in a non-rebreather mask, it's actually going to make the patient slow their breathing. And in turn, they're going to increase their um, uh, the CO2 that's being produced. They're going to hold it in with that decreased respirations. So that's definitely not an answer. Um, Encouraging deep breathing, that's not even going to work. That's inefficient. Administering a bronchodilator, that's really not even a priority at this moment. You want to make sure that you kind of assess or analyze or get that order to check for CO2 retention. So understand with a COPD patient, their normal saturation may be as low as 88% to 92, 91, 92%. So that 91% could be that patient's baseline. So definitely it is not an oxygenation issue. And then remember that patient had a decreased level of consciousness, and that would come from that collection of CO2. And so you have a ventilatory failure with that patient. Let's move on to the next one. All right. So oxygen titration. All righty. So you have a patient with COPD. Their oxygen saturation is 89%. Their respiratory rate is 22. They're alert and oriented. So what's the best action for this patient? Are you going to apply a non-rebreather mask? Are you going to maintain the current oxygen level? Are you going to increase the oxygen aggressively? Are you going to prepare for intubation? I'll give you a second. Okay. You are going to maintain the current oxygen level. Why? Because people with COPD, their target O2 range is between 88 and 92%. So the patient's within normal range. So you're not going to really do anything. You're going to continue to assess and continue to monitor your patient because applying a non-rebreather mask and increasing oxygen aggressively, that's wrong. We talked about hypoxic drive with your COPD patients. And preparing for intubation, that is definitely unnecessary. Understand the NCLEX, with the NCLEX, COPD does not equal more oxygen. COPD needs controlled oxygen, but that's when those oxygen levels go under that 88%. But in this particular scenario, the patient's oxygenation was 89%, well within normal range. All right. So with this respiratory deterioration question, you have a patient. Okay, so you went in to assess your patient in the morning, and their respiratory rate when you went into that room was 30. Their oxygen saturation was 90%, and they were anxious. All righty. And then you went and checked on them again. Now their respiratory rate is 12. Their oxygen saturation is 88%, and now they're drowsy. So what's happening? Are they improving? Are they stable? Are they exhibiting respiratory fatigue and failure? Or does it seem as if their anxiety has resolved? All right. You should have gotten this pretty easily. They are showing signs of respiratory fatigue and failure. Why? Because they were working. Their respiratory rate was 30. They were working hard, and 2 hours later, the respiratory rate was 12. They are giving up. They are getting very tired. And what did we say? When a patient, well, patient will work hard, the body will try to compensate. We have to start an intervention. If we don't, the patient is going to tire out. They went from fast breathing to slow breathing. They went from alert to drowsy. So they are exhibiting respiratory muscle fatigue. Remember, calm doesn't always mean better. And calm and drowsy could be very dangerous for your patient. Now let's look at an ABG question. The pH is 7.3, the CO2 is 52, and the bicarb is 24. The patient is drowsy with shallow respirations, okay? What's the priority? What's the priority interpretation? Metabolic acidosis, respiratory alkalosis, respiratory acidosis, or compensation. All right. Hopefully you got this right. Respiratory acidosis. When you're looking at this, the pH is 7.3. That lets you know that the person is acidic. Their CO2 is elevated, 35 to 45. So they are, and their CO2 is 52. So they're retaining CO2. And this is showing ventilatory failure. They also have that drowsiness. And, with this, I didn't put in a respiratory rate, but even if you don't have a respiratory rate, you're looking at the CO2. The CO2 is elevated. So that's letting you know that they're not breathing out the CO2. So their respirations should be low, and they should be exhibiting hypoventilation. And this is dangerous. This is a dangerous respiratory deterioration. You know, Try to remember a high CO2 and drowsiness should let you know that the patient is having ventilatory failure. Now let's look at that, algorithm framework again. When answering any questions, you need to first check the oxygen status of your patient. If the SpO2 is low, you need to give oxygen. Number two, check for ventilation. If their CO2 is high, or they have a decreased level of consciousness, or they seem drowsy, that should let you know that there's a ventilation problem. And you need to support ventilation so you can remove that carbon dioxide from that patient. Number three, look at trends. I will always say look at trends. Is the patient improving and now they're worsening? What's going on with your patient? And number four, choose the safest action. It doesn't have to be a big intervention, but you need to choose the most appropriate intervention based on what your patient is exhibiting at that moment. You know, when you're trying to, answer questions on the NCLEX, if you want success with these types of questions, it's not about memorization. Okay, it's definitely about recognizing patterns, choosing the next best step. How are you going to apply the information that you've learned in nursing school? You're going to need to recognize, is this an oxygenation failure, ventilatory failure? Is my patient deteriorating? These are the things that you're going to have to really know and understand with patients who have respiratory issues. So that's it. I hope that this lesson helped you kind of think through respiratory scenarios a little more clearly. Um, if it did, please like the video, subscribe to NurseEdScholar. If you want some structured practice, on NurseEdScholar.com, I have workbooks, a clinical judgment workbook. I have other workbooks. I will have a workbook for this respiratory series in the future. This is where you can go and you can download and practice scenarios like this to help you work through the framework step by step and to help you do better in school and in practice. So until next time, happy studying from Nurse Ed Scholar.